My name is Yolanda Linares.
My name is Kelly Dang.
My name is Francis Santiago.
My name is Catriona O'Hara, and this is our presentation of the respiratory system.
To begin, the anatomy and physiology of the respiratory system. First, air comes in through your nose and mouth. Hairs in your nostrils filtrate the air coming in to keep pollutants out of your respiratory tract. Behind the nostrils are the nasal cavity. Membranes inside the nasal cavity have tiny veins which warm the air coming into your respiratory tract. The nasal cavity also produces mucus. The nasal cavity also has cilia which push that mucus back into your stomach to digest it. Mucus traps dust, keeps the respiratory tract moist, and fends off microorganisms. The pharynx is behind the nasal cavity and the mouth. All air and food that comes into your body comes in through the pharynx. Below the pharynx is the larynx. The larynx is a tube of cartilage which contains the vocal cords and is also known as the voice box. The larynx leads to the trachea and all the way to the lungs. The epiglottis is a flap of cartilage that folds over the larynx to keep food from coming in. Under the larynx is the trachea. The trachea is made of cartilage. The back wall of the trachea is made of smooth muscle. The cartilage serves to keep the trachea intact if there is a heavy weight on your chest, to prevent it from collapsing. The bronchi is a splitting of the trachea into right and left sides. The bronchi deliver air directly into the lungs and form the bronchial trees. The bronchi deliver air directly into the lungs and form the bronchial tree inside the lung. At the end of the bronchi are the alveoli. Alveoli are air sacs at the end of the bronchioles. They are wrapped in capillary, and this is where gas exchange occurs. Oxygen diffuses from the alveoli into the capillary, and carbon dioxide moves in the opposite direction. This helps provide the cells in your body with oxygen to survive. The lungs are located in the thoracic cavity. The right lung has 3 lobes, while the left lung only has 2 lobes to accommodate the heart. The lungs are surrounded by the pleural sac, which are 2 membranes with lubricating fluid in between. These membranes serve to allow the lungs to expand easily. The pleural sac attaches the lungs to the thoracic cavity in order to keep them from moving all around. Under the lungs is the diaphragm, which is a dome-shaped muscle which separates the thoracic cavities and the abdominal cavity. When the diaphragm contracts, you inhale. When it relaxes, you exhale.
And now the conditions and diseases of the respiratory system. Bronchitis. Bronchitis is a condition which the bronchi swell up after an upper respiratory infection, such as a repeated infection or illness. What happens during bronchitis? In acute bronchitis, the bronchi is temporarily inflamed, and in chronic bronchitis, there is a repeated illness or exposure to chemicals can damage cells in the bronchi. The cilia becomes damaged, which can't effectively move mucus away from and out of the lungs. The risk. The risk of contracting acute bronchitis is much higher when a person gets sick. Chronic bronchitis is more likely to develop if the patient works in a place with a high amount of pollutants in the air or smokes. The causes. The cause of acute bronchitis can result as a complication of after a lung infection, having a cold, or breathing in irritating substances. In chronic bronchitis, the substance can be caused by constant exposure to fumes or pollution. The symptoms. The symptoms are coughing, overproduction of mucus, fatigue, shortness of breath, slight fever, and chest discomfort. The treatments. There is no cure for bronchitis, but in acute bronchitis, doctors recommend that the patient sleeps, drinks lots of fluid, and avoid cold air. In chronic bronchitis, doctors usually prescribe inhaled bronchodilators or in some cases oral steroids to reduce inflammation. And then prevention. Bronchitis can be avoided by avoiding irritating substances in the air, wearing a mask when present of irritating substances, and washing your hands. Finally, a smoker who quits smoking has a decreased chance of getting bronchitis.
And now, tuberculosis. Tuberculosis is a disease caused by a bacterium that can go unnoticed for some time before it becomes active, causing tissue to become inflamed and die. What happens during tuberculosis? Tuberculosis develops when Mycobacterium tuberculosis bacteria are inhaled into the lungs. This bacterium can cause an inflammation so mild it goes unnoticed, which is called latent TB. Usually, the body captures bacteria into capsules called tubercles. Due to this, most people never go past this stage. If the immune system cannot encapsulate this bacteria, the tuberculosis becomes active. Tuberculosis fools the immune system by stopping macrophages from producing harsh acids after the phagocytosis of the Mycobacterium tuberculosis. The bacteria multiplies inside until it breaks out in a larger quantity. As this occurs, more bacteria quantity increases, and in time, the bacteria can create cavities in the lungs or other body parts, causing scarring or collapsed lungs. The risks of developing TB. The risks of developing tuberculosis are increased since it is extremely contagious. Smoking, drug abuse, and poor nutrition also contribute. The risks of active TB increase when a person is underweight, has a weak immune system, takes corticosteroids, has chronic lung disease, or has had a gastric bypass surgery. The symptoms of latent TB are none. The symptoms of active TB include coughing, thick or bloody mucus, fever, chills, fatigue, loss of appetite, weight loss, chest pains, and shortness of breath. Treatments for tuberculosis are antibiotics. These antibiotics must be taken consistently without a stutter. Some treatments include isoniazids for 9 months or rifampin for 4 months. To prevent tuberculosis, avoid spending long periods in stuffy rooms with infected people. You can also use protective masks. There are also vaccines for tuberculosis, which are rare in the US due to decreased risks. These tuberculosis vaccines are not effective in adults and might indicate false infections on tests. There is also no cure for tuberculosis.
The respiratory system's main function is to take oxygen into the body and move carbon dioxide out. The process of inhaling oxygen is a simple one. When the diaphragm and the muscles around the ribs contract, the space in the thoracic cavity is increased, as is the space in the lungs. This increase in space makes the pressure in the lungs lower, which causes air from the outside to rush into your lungs to balance the pressure. This process is called inspiration. When these same muscles relax, the pressure inside the thoracic cavity is less, and so the air is pushed out of the lungs. This process is called expiration. The respiratory system works together with the cardiovascular system to transport the oxygen inhaled to the whole body. The process of exchanging oxygen with carbon dioxide is called gas exchange and occurs in the alveoli. The blood in the capillary arrives deoxygenated and after gas exchange leaves oxygenated. Like the real respiratory system, the model demonstrates the processes of inspiration and expiration. When the stretched out balloon at the bottom of the gallon is pulled, which represents the contraction of the diaphragm, the pressure inside the balloons decreases, making air rush into them. This mimics the process of inspiration. When the balloon is not pulled, the air inside is let out, mimicking expiration. However, the model is not exactly like the respiratory system. For example, the model does not accurately represent the epiglottis, the pleural sac or the cilia in the lungs, trachea, and nasal cavities. Also, the beginning of the respiratory tract is not divided between the nose and the mouth as the real one is. The 3 lobes of the right lung and the 2 lobes of the left lung is not clearly identified, and the left lung is not smaller than the right, as it will be in the real respiratory system. We have now concluded our presentation on the respiratory system. We have reviewed the anatomy and physiology,
The conditions,
and the comparison between our model and the real respiratory system. Thank you for
watching.